Hello and welcome back to the video series. This is the video 58, Staying Healthy During COVID Pandemic. Today we're going to look at why there's less people are dying from COVID-19 in warmer countries. There is a controversial issue and people has a difference of opinion. So, to control an epidemic or pandemic, one need to understand the behavior of the infectious agent, in this case COVID-19, and its pattern of spread, associated immunity-related issues, and the method of infection in a given community, and indeed the associated risks and vulnerabilities. So why tropical countries have extremely low death rates reporting? So almost all of them are around the equator when within about 1,000 kilometers north or south. So countries around the equator including Sri Lanka, Pakistan, India, Malaysia, Cuba reporting markedly less prevalence and indeed the unusually low death rates than expected compared to those countries situated in the northern latitude, and now the wind is spreading to in the southern latitudes as well. With exception of few countries such as Sweden, Finland, Iceland as well as New Zealand, the highest death rates are reported in countries with a cold climate in this pandemic. Having a reasonable vitamin D status lead to less severe illness, quicker recovery, less hospitalization, and low death rates indeed in tropical countries as well as elsewhere if they have that. However, there are other key factors influencing these statistics. The most important factor in the less number of PCR testing carried out in these countries compared to Western and Northeastern Asian countries such as North Korea and Taiwan, and indeed the total lack of PCR and antibody testing in the community. So these two factors together will influence over 80% plus of the reason why these countries are actually reporting low and indeed misleading numbers of the prevalence as well as the death rates. So it is surprisingly the answer is no. For many people wondering why low prevalence and death rates from COVID in these countries. So as I mentioned, the major reason is that these countries do not carry out the appropriate numbers of PCR testing. So you don't do testing, you will not diagnose, especially in the community. So you're going to miss about 85% of the person who infected with the COVID-19 in the community because these countries either not carrying out or refuse to carrying out PCR testing in the community. Most of these mentioned equatorial countries categorized as a developing or emerging economies. The GDP and the healthcare system in these countries have nothing whatsoever to do with the low death rates from COVID. However, universally, these countries have purchased lowest tender of the poorest quality PCR kits. And I have seen no one is discussing this issue, but it's one of the key issues affecting the quality and the numbers reported with PCR, even if they tested in hospital. So these kits are coming mostly from China with a significantly inferior quality. For example, these have the less detection capabilities with false positives and markedly high false negative testing. Unfortunately, most of the countries using these inferior quality PCR testing even does not test these false positive and false negative incidences. This is really sorry status. The low sensitivity of detecting of those with COVID-19 lead to missing the diagnosis in the majority of the people with the infection, especially those in the relatively lower viral load. So you can imagine that the test is not carried out, or even carried out with the low detectability capabilities. This health department will not be able to diagnose people with COVID. So they are reporting the numbers what they detect with the high viral load and those are coming into the hospital and none from the community. So these numbers reported by most of these countries are highly unreliable and grossly underestimated. It's noteworthy that none of these countries carrying out community-based testing, neither PCR nor antibody testing in a meaningful manner. In part, of course, this is due to cost, but in certain countries, this is a political decision to demonstrate that there are less COVID-19 patients than others and to demonstrate that they are doing a great job, and the fact is it is not. So pretending that they are doing a better COVID control rather than their neighbors or Western countries. As I stated in a previous video, these numbers have nothing to do with the tight controls like curfews or lockdown, and indeed nothing to do with the healthcare facilities or the delivery in these tropical countries. It's simply a logistical issue. These countries are doing, in fact, less than 5% of the number of PCR testing by other countries like the U.S.A., U.K., South Korea, Australia, and most of the European countries. So no wonder why these countries are reporting low numbers of PCR positive tests, because they're doing only 5% of the tests they're supposed to do. So the key reason why the reported COVID-19 numbers are so low in these tropical countries is not doing PCR testing, nothing else. Therefore, the reported numbers are artificially low and misleading the global community while taking credit falsely. In addition, the data supposed to spread the survival of COVID-19 is hindered in the presence of higher temperature and humidity like summertime in U.S.A. These shared characteristics of equatorial countries is another advantage for the health departments to control the COVID, which is a natural control, and it will help the people not getting into severe complication. Favorable weather and relatively lighter skin color, according to the Fitzpatrick scale, compared to African Americans, and indeed excess of 300 days of sunshine each year, causing less prevalence of severe vitamin D deficiency in all equatorial countries. Again, this happened naturally and no interference or involvement with the government or health departments. Consequently, the innate immune system of inhabitants of these countries are relatively stronger than those who live in the colder climates, like in northern United States and Europe, for example, which is a major advantage of facing COVID-19 epidemic. Collectively, these lead to lower prevalence of COVID-19 and indeed death rates. Even in sunny states like Florida and Carolina in the U.S.A. and indeed Australia, for example, and in other colder countries like in UK and Northern Europe, the vast majority of people dying are non-whites with a darker skin. Again, the statistics is very clear who's dying and who's not in this colder climate. Simply because the person with a darker skin color producing much less vitamin D even during the summertime. Therefore, during the winter particularly, they are much more vitamin D or severely vitamin D deficient, and thus when compared to the white person who has a reasonable amount of vitamin D and therefore reasonable amount of innate immunity. So These folks are unable to fight against COVID-19, therefore develop complications, ICU admissions, and indeed higher deaths. So in summary, the lower reported prevalences in tropical countries are primarily due to fewer PCR testing, thus making less diagnosis. Simple as that. Refusal to carry out community testing in some of these countries clearly is a political decision, nothing to do with the health issues. In other countries, it's due to the lack of funds or inadequate funds. However, this is augmented by the presence of favorable weather, so it helps the countries to control COVID-19 spread automatically thanks to the weather. The low rates have nothing to do with the government actions such as lockdown, curfews, or healthcare delivery in any of these countries. In the next video, I'm going to talk about the second wave of COVID-19, which is in the horizon. So please join then. Thank you.